Pullman Regional Hospital's Center for Learning and Innovation introduces a palliative care program, providing specialized medical care for people with serious or chronic illnesses. Palliative care is appropriate at any age and any stage in a chronic or serious illness, such as cancer or Parkinson's. Palliative care can also be provided along with curative treatments.
Palliative care looks at the whole patient, and it seeks to lessen pains, worries, concerns, and other things that get in the way of potential healing. The whole goal of palliative care is to give patients and their family the highest quality of life for the longest possible time.
Palliative care has become clearly a very strong umbrella approach to how we can deal with people in the early stages of recognizing disease or illness, all the way through the various steps to that ultimate stage of preparing for the dying part of an illness. So palliative care is perfectly aligned with what we're trying to accomplish through our Center for Learning and Innovation.
When I describe palliative medicine for people, I kind of describe it in two ways. First off, my job is to help you live the very best life you can right now, regardless of what you're going through. Now that seems like a big measure, but really what that means is helping you anticipate things or challenges that you might go through, make decisions regarding your health, so make sure you're getting the full picture, and make sure you're understanding what your prognosis or what your decisions might entail. My other part of my job, though, is to help you kind of come to terms with what you might expect ahead. We call that prognostic awareness, basically knowing what you might have ahead for your illness. That helps people make decisions, which are very important.
Palliative care can be going on at the end of life too, but as opposed to hospice, it's not there just for the end of life. You can be in palliative care for 5, 10, 15 years as you're progressing through the process of your disease, and everything that changes in those times, are all part of palliative care.
At Pullman Regional Hospital, we have developed an interdisciplinary team called the Quality of Life Team, which includes a board-certified physician in palliative care, a pharmacist, respiratory therapist, nursing, volunteer chaplain, and social worker, along with 4 LNEC nurses, end-of-life nursing education. The team works with the patient's primary care physician and supports the ongoing care of the patient.
Our biggest goal is comfort, and it's really important to find out from the patient and their loved ones what comfort means to them, and helping reach that as a goal is our primary goal.
America is aging at an astonishing rate. According to the U.S. Census Bureau, around 10,000 baby boomers in the United States will turn 65 every day until the year 2030. Many of these people will live with a chronic illness or experience a serious illness that need management from a quality of life and cost standpoint. The annual per capita healthcare costs show the U.S. is spending much more on healthcare for older ages, starting around 57 and exponentially increasing up to age 85.
If you look in the literature around palliative care services and the impact they've had on how we deliver healthcare services, it is just prevalent that first and foremost, patients get the kind of care that's really important to them, to live with chronic illnesses. So patient satisfaction is very high. Then the second arm of it is that they really get higher quality of care because we understand what kind of care they really want. And at the same time, most people want less hospital services or healthcare services if we really take the time to ask them about it. So it lowers the amount of money that we spend or that insurance companies spend on giving the patients the kind of care that they really want.
Pullman Regional Hospital has a dedicated palliative care room for patients with serious illnesses who are at the end of life. The room provides a home-like atmosphere for the patient, their family, and friends.
The Palliative Care Training Center at the University of Washington recommends these 7 questions, which may be useful in obtaining the patient's and family's stories and gaining a deeper understanding of how to deliver the best care possible aligned with the patient's needs and desires. How do you see the situation you and your family face? What are your past experiences in caring for others who are seriously ill? What are you hoping for in the coming days, weeks, and months? What are your main worries, fears, or concerns? Where do you draw strength to get through each day? Do you have a core family that will support you on your illness journey? Is there anything else about who you are or what you believe that we should know so that we can provide the most respectful care?
For more information on Pullman Regional Hospital's palliative care program, visit pullmanregional.org or contact Katie Everman-Druffel, social worker at Pullman Regional Hospital, or Joan Hendrickson, Assistant Director of ICU and Med-Surg at Pullman Regional Hospital.